Okay, week 2 clinical video, scanning the room. This is my patient, and we're about to begin. Hi, how are you? My name's Shanika. I'm going to be a nurse today. I'm doing my hand hygiene, patient privacy, closing my curtain for patient privacy. Hi, I'm Shanika. I'm going to be your nurse today. Can I start by getting your name and your birthday?
My name is Chance Brown and my birthday is February 21st.
Do you know what today is?
It's Saturday.
Okay, cool. So what brought you in today?
My stomach hurt and I'm constipated.
You're constipated? And how long has this been going on?
About 4 or 5 days.
Okay. All right. So I want to start off with checking his orientation and his hygiene. Everything looks good. He looks well mannerable, great spirits. He's sitting up. I don't see any noted bruises or lesions on his face. And I'm going to start by touching your scalp, okay? I'm touching and palpating his scalp. I see no dryness, no cracks, no abnormalities. Does this hurt when I touch? All right. I'm going to start off with touching his sinuses for feel for any swellness or edema. Does this hurt when I touch? Maxillary sinuses and frontal sinuses are together. No edema, no swelling, no tenderness when palpating. Then I'm going to check his 7 and 12 cranial nerves. Can you do some faces for me? Can you squint your eyes? Can you stick out your tongue? Side to side. Say, ah. Can you squint your nose? All right, cranial nerves 7 and 12 are intact. Now we're going to start with these 6 cranial fields of gaze. I want you to follow my pen. Keep your head straight though, okay? All right. All the cranial gaze fields are intact, and that's 3, 4, and 6. Now we're going to go with checking his pupils. Look off and look up. Look back right here. His pupils are pearla. They are round, accommodate to light, and reflect to light with accommodation. So his eyes are pearla. And now we're going to start off with his ears. We're going to palpate the ears for any tenderness. Does this hurt when I palpate this? No tenderness when palpating, no lesions. Everything is intact, no abnormalities. Now I'm going to look into your nose. Nasal nerves are pink with no discharge, no lesions. Let's check your patency. Let's breathe in. Other side. Patent in both nose. Now we're going to start off with your maxillary mandibular jaw for any abnormalities. Open, close, short, slowly. Good job. Again. No tenderness or cracks. Move side to side. No jaw locking. All right, let's open your mouth. Say ah.
Ah.
Tonsils have no white exudate, no lesions in the mouth, no dental carriers. Soft and hard palate are intact. No lesions outside of the mouth. Now we're going to check for your posterior and your anterior lymph nodes. No palpable lymph nodes in the posterior or anterior lymph nodes. Now I'm going to check your carotid pulse. And also his tonsils were a 1+ on both sides. Carotid pulse on both sides is a 3+. Now we're going to check for Thyroid. Swallow for me. No abnormalities or lumps with the thyroid. Clavicular lymph nodes are non-palpable. Now we're going to check your shoulders. See if you can show your shoulders for me. Now, we're going to get you to take this jacket off. Can perform basic skills by himself. I see no bruises, no lesions on the body. No swelling, no abnormalities. Does this hurt when I palpate? All right. Now we're going to listen 6 places in the front and 8 places in your back for your breathing. I want you to just breathe regular. You don't have to breathe in and out. Just breathe regular. We're going to do 3 on both sides. Lift your arms up for me. Lungs are clear, no crackling. So no fluids present in the lungs. I want you to lay down. I'm going to listen to your quadrants. Now we're going to move on to the abdomen and we're going to listen to the quadrants. I hear bowel pattern sounds in all 4 quadrants. Normal bowel pattern sounds. Now I'm going to palpate. I want you to let me know if you feel any tenderness. I see no lesions. Just relax. I feel no palpable gallbladder. No palpable liver. Everything is normal. Does that hurt? Now I'm going to palpate deeper. Does that hurt? It's round, smooth, no lesions, umbilical, round, smooth, and not engorged with hernia. And you said it's been hurting for about 4 days. Can you describe what your poop looks like?
It's like a ball.
Okay. All right. And that concludes the abdomen.